Okay, so we're going. Yes, we're going inside this. This is a wonderful opportunity. The Brock Institute is involved in this. Tell us about that.
Yes, so the Brock Institute is the Center for Community and Global Health here at EVMS, and we're trying to help educate our students, residents, and faculty members how to help take better care of our community. And one of our speakers this morning was Dr. Bruce Waldholz, who is a local gastroenterologist and actually a former chair of the board of the American Cancer Society's Southeastern region. And we have out here the giant colon. And this is an example of various findings that a colonoscopy would find. And our hope is that raising the awareness that colon screenings can be done very easily in the right people, and we can actually save lives and prevent people from dying from colorectal cancer.
So what are some of these things we're looking at?
Yeah, so this one is an example of the most severe type of cases and findings. It's malignant cancer, or that's the cancer that can really start to spread throughout the body. And you can see it's very diverse, and it can be seen. But the problem is this can actually only be the surface, and it can penetrate the wall of the colon and spread throughout the rest of the body. So we want to try to prevent that. One of the things we can look at is this is usually represented the normal tissue of the colon, and there are different iterations of it, and you can see that there are folds that sometimes polyps can be hiding in there. So having the appropriate prep and having the air to inflate the colon can help open the areas, look at the surface, and detect findings that sometimes could be hidden. This is an example of a polyp, and there are some polyps that can easily be removed that are not cancerous, but there are some that will actually transform and evolve into cancerous polyps. So the important thing is if we can detect these very early, they can be removed, and that could be the cure, but that has to be monitored every 1, 3, or 5 years.
How common are polyps?
Colon polyps are very common, especially in people who are overweight, who have a family history of colon cancer. And so these are opportunities for us if we get the appropriate screening. Once someone is age 50 or early when they have a family history, we can actually detect these polyps, remove them, and actually prevent them from progressing.
So if you have a polyp, is that a sign that you could have cancer?
Yes, and oftentimes when a colonoscopy is performed and the polyp is removed, those specimens are sent to the pathologist to be able to look at under the microscope, and they can detect whether or not it's a precancerous polyp or an actual cancerous polyp. And oftentimes that can tell what the next phase of treatment is. Oftentimes just removing the polyp is a cure, but if it's a malignant or one of the bad cancers, oftentimes additional surgery may need to be performed, taking out a part of the colon, and then chemotherapy or radiation therapy may be indicated, again, depending on how far progressed it is.
Okay, so these are regular, normal polyps that you would see, and then over here...
Yes, this is a malignant polyp, and as you can see, it's representing a little bit more complex, multiple groupings, and penetrating a little deeper into the wall of the colon. So as you can see, it'd be very difficult to simply remove these just by one procedure. So oftentimes this is one that will require several steps, such as removing this portion of the colon and possibly requiring chemotherapy or radiation therapy.
Well, thank you for our walk through the colon.
You're welcome.